As well as Shashidhar sir for giving me this opportunity to come here and be present with you all and present on this topic which is very special to me, that is neurodevelopmental rehabilitation. And it's an honor that sir and madam are chairing this session. So first, in this session, in this presentation, I would like to go through the introduction, importance of the early intervention, theme, role of each members, and then the role of rehabilitation. So coming to the neurorehabilitation, as we all know, that is to enhance the recovery, rehabilitation and educating the children. So what all domains it can include, that is, we all know that one is the motor physical development or a cognitive development, that is thinking, reasoning, problem solving capacities, the other things. Communication, which includes receptive as well as expressive language, social and emotional development, adaptive development like self-help skills like eating, drinking, dressing, all these things. So this can include any one of the domains, whether we call it as a isolated or multiple domains. So to name the few, there is a big list. So these are all the things which we come across in our day-to-day life. That is like developmental delay, global or isolated, cerebral palsy, autism spectrum disorder, ADHD, speech delay, so more. So developmental coordination disorder is another thing where we see child is normal in all the sense with a normal IQ, but the child will be having fine motor issues, gross motor issues. So these are the things. Other than that, genetic syndromes, anxiety, depression, tics, stammering. If we look into it, the prevalence is, it's almost what the inclined trust says, in India, between 2 to 9 years of age, it's almost 1 in every 8 kids. They have one or the other kind of developmental issues. So whereas CDC says that almost 1 in 44 children are having autism spectrum disorder. So that high is the prevalence. So what is required is the neurorehabilitation. So when we can start rehabilitation? When is the time to start the intervention? It is as soon as possible. So when the child is, when the baby is stable, when we know these are the high-risk babies, it can be started as soon as possible. What happens is, usually the severe disabilities gets detected by around 1 year of age, before 1 year itself. Correct? So whereas the minor ones, which forms around 18%, they get detected only by the school age. So it is missed. So what tells is, like many studies have shown, that this comprehensive multidisciplinary team, when we provide them the therapies, their IQ, cognitive scores are much better than compared to that of children who do not receive it. So how we can pick these kids? That is with the help of developmental surveillance, which we do usually whenever the child is coming to us. Whenever they are visiting us, whether it's a well child clinic, whether it is for a vaccination, we take histories, we do examination by that, or by using the developmental screening tools. So what IAB as well as AAB suggests is, the developmental screening is must at around 9 months of age, 18 months, 24 or 30 months of age. Why? Because by using the screening tool, we can pick them up very early. So what are these screening tools, what can be used? See, the screening tool, this development screening itself is a big topic. I am not going to touch in detail, but I would like to touch upon the only thing, that everybody should use these screening tools, which can be brief, which is inexpensive and easily, which has a very good psychometric properties. Like as we know that every pregnant mother gets these maternal and child health protection cards. So they do have the developmental component in it. So we can train the mother or even the our office staff who can pick up these red flag signs if the child is not attaining any particular milestones. Or else we can use the simple ones like TDSC, TDST, GMCD, these all takes lot of time. So when you have a time constraints, it is better to use any one very simple ones. Even the online apps are also available. So another very important is using this MCHAT-R, that is Modified Checklist for Autism for in toddlers, that is a revised version. This has to be, this age range is between 16 months to 30 months. In that age range, when we have to screen them, because that can pick up the early, the children who are at risk for autism. The very important thing why it is required is because of the early intervention. Why this early intervention is that important? If we see, that is because of the neuroplasticity. And what is this neuroplasticity? That is the development of the brain. If we see in this picture, we can see that the synaptic formation is very high at 6 months and 2 years when we compare that with the 4 years and 6 years. So that's what it is suggested, that early intervention when we can give a very good results. So that is because of the neuroplasticity. Now coming to the team, it's not possible for one person just after detection to solve the problem. We need a big team. So what are those teams? So it is the developmental pediatrician, along with them the clinical psychologists, occupational therapists, pediatric physiotherapists, special educators, speech and language pathologists, applied behavior analysis therapists. This is the core team. Other than this core team, we have to have the support of the family. So we all work with the family along with the child. So after that, we need the support from the school as well as the society. So after the intervention, we need to include them into a normal stream. So beyond that, then we have to think about the vocational training, how we have to make them independent. So there are many people who are included in it. So just to go through like what is the role of each members. So what a developmental pediatrician or pediatrician's role is to do the evaluation. Find out what is the cause for it, diagnosis, then give the medical management whenever the child requires the medications, and then suggesting the proper therapies. Proper therapy with the proper frequency of therapies, that is what is very important, that we need to do it. Then guiding the parents what is right and wrong. When we look into the team, they are all the professionals who know about their field. But here the pediatrician has a role, because as a pediatrician we know overall about the child. Like what the child is having, whether it is a behavioral problem, whether it is really a medical issue, what is happening. So leading that team and looking over the program, that is very important. Then comes the occupational therapist. As we all know, they work with the motor skills, fine motor, coordination, balancing, strength, activities of daily living, writing skills, sensory issues, what sensory integration training, school readiness, all other work by the occupational therapist. Pediatric physiotherapists, as we know, physiotherapists, they work with the cross motor, strength, flexibility, posture, gait, movement patterns, as well as the use of adaptive equipment, that is how the orthotics should be used, whether it is an AFO, whether it is a KFO, hit arch, without arch, everything has to. We know that they work on the cognitive aspects of the communication, over the speech, over the language, there are different components in it, augmentative and alternative communication, oral placement therapy, voice therapy, swallowing. Then clinical psychologists, we have to look into, we have to assess sometimes the child's IQ assessment, learning disability assessment, aptitude and personality testing, career guidance, and there are many other like anxiety scales, depression scales. Then to give the training, cognitive behavior therapy. Cognitive behavior therapy may be for many reasons, like whether it is for the tics, whether it is for the anxiety. So counseling the parents, counseling as well as the other psychotherapies. Special educators, they are the specialists who look into the grade level of the child, setting the IEP, individualized education plan for the child, and training. What it is nothing by bridging the gap where the child is and the present age. We have to bridge that gap with the therapy. Then coming to the applied behavior analysis, this is actually a specialized program. It's actually a BCBA, it's a board in US. So they have prepared this program which helps for children with autism. So they do work with the problem solving behaviors, so all related to the behaviors. How? That is by improving their language and communication, improving the attention and focus, improving the social skills, memory, academics. So this is how the team members are, what are their roles. Now coming to what the neurodevelopmental rehabilitation can do. So when rehabilitation, it takes lots of time. It takes lots of patience, motivation, and whatnot, lot of things, but it does wonders sometimes. So here I would like to show certain videos of our kids who have undergone the therapy and what the improvements they are showing. Kind disclaimer that the videos presented here is for the intended for the informational purpose with the informed consent.